Good day, good morning, everybody. My name is Rolando Mia, and welcome to Dr. Tom's Tips on Tuesdays at 10. Today, we're going to be talking about a topic that's near and dear to a lot of people, and a lot of people have asked us this question. And the question is this: how do you start out with the Isolite, whether it's new to you as a system or whether you've had it for a while, but you haven't used it, and now you're using it again. So I'd like to welcome Dr. Tom Hirsch. How are you, Dr. Hirsch? How are
Roland,
things?
I'm great this morning. How are you doing today? Good?
I am very, very well. By the way, I want to say that Dr. Hirsch is quite the gentleman. So we've kind of created the term.
God. I have to listen to this every time I talk to you, but it's a lot of fun. Okay, Tom, Tuesday at 10. Yes, dear.
Oh, go ahead.
Okay, so that's the first thing that every man has to learn how to say in his life. Yes, dear. That would go a long way. So, yes, this is Tom's Tips at Tuesday at 10. And so here we are back again. We're just going to say this for just a moment. It looks like we're getting a resurgence of COVID. I don't want you to focus on that, but I do want you to be very safe with your patient treatment and make sure you're safe for yourself. This pandemic was sweltered upon by the political situation that's going on out there. It's horrible. We won't get off track on that, but be safe. And so part of being safe is utilizing the Isolite to control your airborne aerosol. So today I'm going to talk about tips on starting out with Isolite. We've had so many new customers that have come on board that I want them to listen to this and really know how you introduce the Isolite to your patients, how you start off with Isolite, what you have to say to your patients. And for those of you that are reintroducing Isolite back into your practice where you're just getting it out of the closet and hooking it back up again, spend a few moments, just listen to me and listen to what I have to say. So the most important thing, even before we get to a patient, the most important thing is take the Isolite and try some insertion on your staff. Be comfortable placing it in your staff's mouth. And once you've mastered that, and it will take 4 or 5 insertions to be able to know how to get that in smoothly with one easy movement. Once you're done that, now you're ready to go ahead and start with the patient. So very, very important. Start with a compliant patient. Don't start with a gagger. Don't start with one that's going to be difficult. Don't start with a patient that you don't know. Start with a patient that you do know. Start with one that that's your friend. Start with a patient that's going to be good with dentistry. You don't want to start with a dental phobic, and you don't want to start with one that's a gagger. Get somebody that can actually talk to you and tell you that you're doing something right, or you're doing something wrong, or oh, that pinches, or whatever. Just start with that patient. And when you introduce the Isolite to the patient, tell them about the system a little bit. Say, this is a system that's going to keep your situation, your mouth, a whole lot more comfortable. All that you'll have to do is just sit there and rest on the Isolite. You'll just rest on the bite block portion here, so you do not have to strain your muscles to keep open. You just rest your mouth throughout the whole procedure. That way, when we're finished with the procedure, you will be a lot more comfortable and your mouth won't be fatigued. So, number one, start with a patient that you know, and then start telling them about the system. It's more comfortable. They can rest their mouth on it. The other thing that the system does, it eliminates a lot of the fluid and debris. So this is going to protect anything from going down their throat. It's going to protect their tongue. It's going to protect their cheeks. And it'll keep things from being swallowed or accidentally aspirated. So that's the first thing. Introduce it to the patient. Spend a few minutes talking to them about it. Show it to them. Let them see how soft and flexible it is. Let them touch it. Let them feel it. You can actually push it up against their face, on against their lips, so they can see. There's no sharp edges. There's nothing that's going to injure them at all. So next thing that we need to do is we're going to start with a very simple procedure. If you all remember back in dental school, what was one of the first procedure they had me do in dental school when we actually started working in the clinic? It was a class 1 amalgam. Now, we don't do class 1 amalgams anymore. We don't even do amalgams anymore. But that's about as simple as it gets. A simple procedure. So start with a single tooth procedure. It can be a composite procedure. It can be an inlay. It can be an onlay. It can be a crown. But just I subscribe to the KISS theory. It's that keep it simple, stupid. Keep this thing really simple. What you don't want to do is you don't want to start with a complicated situation. You don't want to try and do a class 5 composite filling on the lingual of number 31. That's tough in anybody's boat. So that's not where you want to start. Do it really simple. You just might want, even for access wise, you might want to start with tooth number 30, 28, 29, 30, 31. You'll have great access to those areas. You'll have great visibility to those areas. Your assistant won't have to be in the mouth with an HVE or any other aspiration. You can just kind of get this whole area isolated and work by yourself. So a single tooth, a mandibular tooth. Before you start this, I want you to just review mouthpiece placement prior to treatment, how you go in there. So as I said, review that with your staff. So those are kind of the tips in doing that. And then once you've got that in the mouth, go to work and see how great it is.
That's awesome. So I love it. Really simple. First of all, make sure your team understands what the system is. So very much appreciate that. And explain it, and we can help. Number 2, I like this. Start with a compliant patient. It sounds someone that you're comfortable with, so that it doesn't turn into some big thing, specifically even before you start your procedure.
Right.
And then it sounds like it's really important to explain the system to the patient and let them feel and touch it. I like that piece. And then simple procedures. Anything else? I mean, simple procedures, single tooth, that type of stuff. Anything else, Dr. Hirsch?
Don't start off, as I said, don't start off with a full mouth reconstruction. Those are tough enough. Yeah, if you've got a complex case where there's going to be complexities that are going to be in there, where you've got some deep margin, there's going to be a lot of soft tissue management problems, you just don't want to go there. This will be a great system in all those instances, but that's not where you want to start. You want to start with something that's just so simple you can do it in your sleep.
Awesome. Thank you for that. Really appreciate that. When you look at it, Isolite, there are some subtle techniques that Dr. Hirsch is covering, and every Tuesday we cover these tips. If during the course of it, take the time to do that. Well, we just got a message here, Dr. Tom, look at this. Oh, maybe you can speak to Sarah Lawrence. Love the Isolite, easy to place even in pediatric patients. Any tips on dealing with or working with young patients for the first time?
Yeah, you know what? I learned this from the pedodontist. I'm sure Sarah does this also. You sit down there, she calls it a squishy fish. And so sometimes you can call it a squishy fish, or even you can take any kind of a marker and you can draw a face on this thing. You can draw an eye on this thing and your little smiley face. You can draw an eye right there. You can make a little smiley face. You can have all kinds of fun stuff with this. And so my pedodontist called it the squishy fish. Make sure you lubricate this thing too. But kids do quite well with this thing because it's a whole lot better than a clamp, a rubber dam clamp. They pinch the gums. They're invasive, much more so than an Isolite is.
So awesome. Well, if our viewers have any questions, if you have additional things that you'd like us to cover, please let us know. If you like the content of this and you want to hear more from Dr. Tom Hirsch, our dental man, please ask us, share this, and we look forward to spending time with you on next week's Dr. Tom's Tips on Tuesday, terrifically.
Tom's Tips on Tuesday at 10. Be really careful out there. Really watch what you're doing. Reduce that airborne aerosol. Wear your mask. Wear your face shield. Wear your gloves. Clean the room. You know what I found? This is another good tip. What I found in our office is we have a system in the office right now of just cleaning down everything. And when the patients see the sterility that they're doing and the extra steps that we're going through, they really appreciate that. And they come and they thank me. I mean, I said, this is what we do all the time anyway. We're just taking it to a different level. But they are really appreciative to know that we're being as safe as we can be in the office. And so that's a big one.
Awesome. Thank you so much.
You're
Appreciate
welcome.
it. Thank you for joining us. We look forward to seeing you all on Dr. Tom's Tips on Tuesdays at 10 next week. Have a great
everybody.
week. Have a safe week. And Dr. Hirsch, you're awesome.
Thanks a lot. Good talking with you. Bye-bye. Bye, everybody. Be safe.